specifically, and I think it's important that we talk in some specifics, that some of the great things that are in this bill include requiring insurance companies to cover pre-existing conditions, which is, I mentioned in the other video, and is something that has angered Americans for decades, and it's wrong, it's unethical, and this bill has made that right, and I'm proud of the Congress for including that provision. Secondly, and probably the biggest boon to the bill is that it has successfully expanded health care coverage to millions of uninsured Americans, folks who they're working Americans. They do earn a living. They work hard to earn a living, but they make just enough that they don't qualify for the full ride that you might get if you make zero or well below the poverty line. But they're self-respecting folks who want to who personally need health insurance coverage, and who certainly want their families to be covered too. And this bill has enacted something that I believe to be noble and right, and that's to make sure that Americans don't live in fear and don't neglect taking care of obvious health issues because they can't afford it and because they're scared that they're going to go bankrupt if they go see a doctor. A third great benefit and highlight of the bill as it was passed is that it forbids insurers from arbitrarily dropping high-risk patients. As I think you all know, a lot of the insurance industry is really about risk management, and so as soon as an insurer can identify someone as a high-risk patient, somebody who's had one of those pre-existing conditions, who has a history of cancer or some genetic condition that gets passed down through the family, in the past, insurers were able to just drop those people with little or no notice and little or no reason. And so now this bill has provided a useful corrective to that. With that said, and there are other good things, I just my space is limited here. There are also a number of things that ensure that this bill isn't perfect, and that's where the future comes in. That's where the hope comes in. That's where we work to say, well, let's make it better, rather than just griping and bitterly complaining over in a corner. We say, okay, let's bring new ideas and new solutions to the table and improve this bill, make it even better. One of the things that I think will be important to repair and to improve soon is the issue of how the bill is paid for. Now, one of the most controversial components of this bill is the fact that we are, as a country, economically and financially not in a great place right now. We're struggling and mired deep in national debt and with a growing national deficit, and it's imperative. My commitment is to responsible fiscal management of the country and of the states, and it's important that we don't dig ourselves deeper in a hole that we're already in. And in particular, I just wanted to point out this one issue. From really the beginning of this the process that led to this bill and now this law, the administration has argued that most of the costs associated with expanding healthcare coverage will be paid for by the recovery of fraud, waste, and abuse that's in the healthcare system. Now, as many of you know, I've worked in a few different areas of the healthcare system, and I want to concur on one hand that yes, there is fraud, waste, and abuse, but as a person who's been in the trenches, I'm fairly convinced that there's not sufficient fraud, waste, and abuse to pay for the entirety of this bill. And so I don't exactly know where the Congressional Budget Office or the other folks that the Obama administration is getting their numbers from, how they calculated all of those. I've seen some of those and kind of crossed my eyes at a few of them, again, having worked in the industry. for some time. The system of recovery of fraud, waste, and abuse is like any other audit type system, can be a very stressful one, and so yes, we've got to address this issue, but we've also got to be realistic. We can't go on a witch hunt for hospitals and physicians and pharmacies and other healthcare providers and say, like many of the recovery audits for both Medicare and Medicaid have been doing over the last couple of years. We are here to collect several hundred thousands or maybe millions of dollars from you, and we're going to throw a mountain of paperwork at you that there's no way that you and your currently contracted staffs could possibly wade through, and we're going to make you prove the negative. We're going to make you prove that we didn't overpay you for something, and you know, which is a really difficult, if not impossible, proposition. And some of these auditing companies are paid a percentage of their haul. And anyway, there's a lot to be corrected in that process. And my broader point is that we can't pay for major legislation in this very idealistic notion of just recovering what is currently fraud or wasted or abused in the system, unless we're also proposing as part of our legislation that we're going to rewrite human nature, because it is in human nature, unfortunately, that folks do have a tendency, when it's in their best interest, to commit some forms of fraud or to be a little bit wasteful or to abuse the system in some ways. And so even if we cut out fraud, waste, and abuse in the ways that are going on today, unfortunately, new forms of fraud, waste, and abuse will continue to occur. We're not wiping out fraud, waste, and abuse entirely. And so as long as it exists, I think it's kind of a tenuous proposition to say that we're going to pay for a huge expansion of the costs of our government by that. So this and others present real problems, and we can either gripe about them or we can seize those problems and choose to recognize them as opportunities. We've now made a commitment that we as a country are going to improve our healthcare system. I think that's a noble and good commitment, and I think most importantly, it's a start. And if we keep in mind that this is a start, and we say we're not going to be satisfied with it as it is today, but we're going to make it better, we're going to provide better coverage at lower costs to more people over the coming years and decades, and we're going to get our healthcare system on top as it should be, then that's the right attitude. That's the attitude that's going to produce better results.